And good afternoon. It says that I do not have a good wireless connection, so I don't know if I do or not, but we're going to try and see if we can get this done. Happy 2025. This is the first Lunch and Learn of the new year. And remember that I am a holistic practitioner. I'm going to be giving you some information about blood pressure medication. And so you always want to check this out with your doctor. Don't take my word for it because I'm not qualified to tell you what to do. However, I am qualified to give you information. And so that's what we're doing today. Blood pressure, medication, information, and some natural alternatives that you can choose. Again, don't quit taking medication just because of the information I'm giving you today. You want to take this information, discuss it with your doctor, and make those kind of decisions with him. So blood pressure medications are among the most overly prescribed medications here in the United States. In a new study that challenges decades of medical practice, the results suggested that nursing home residents might safely either stop or reduce their blood pressure medications by 30% without an increased risk in heart attack or stroke. So more than 70% of adults 60 years and older have high blood pressure, and more than half of those take blood pressure medication to prevent cardiovascular events such as heart attacks and strokes. For those who don't need blood pressure medication, taking these drugs can do more harm than good. Now, remember, here in the United States, there's something called standard of care. Standard of care is, I don't care how old you are, I don't care what color you are, I don't care your physical, if you're overweight, underweight, whatever, I don't care about any of that. This is the standard. If your blood pressure is high, then we're going to do this 100% of the time. And so this is the thing that bothers me about allopathic medicine is because we don't want to be a one-size-fits-all. We're not a one-size-fits-all. Every person that comes to see me gets individualized care and attention because I know everybody is different. And so when we do our Tuesday testimonials and all that kind of stuff and we have great results and somebody invariably, I want what she got. I want what you did for her. It's not the same because you're not the same. And so what they're finding is just because you've got high blood pressure does not mean that you need medication. And if you're taking medication, it could do more harm than good. Again, I am not a medical doctor. I'm a naturopathic doctor, so you're not supposed to take medical information from me or medical recommendations. So I'm not recommending, I'm just giving you information. Now, older adults have a higher risk of adverse drug reactions and side effects from taking multiple medications. This is called polypharmacy. Their ability to absorb and eliminate the metabolites from the drugs is impaired because of their physical condition, whatever diseases that they're dealing with, and also just because of their age. Taking people off these drugs can reduce the side effects such as dizziness and falls and other potential interactions with the other medications. Now, when you come to see me and you have a list of medications, I am going to run all of your drugs through a web page. It's called Medscape. Medscape. You don't need to be a professional to use this. Anybody can use this. It's free. You just run all your drugs through there, and it will tell you if you have any interactions and whether they are serious, moderate, or associated, I think is the least one. We always give you that piece of paper that you can take back to your doctor, take back to your pharmacist, and say, look, I don't know why you're prescribing what you're prescribing, but according to this, I'm having these interactions, and it's all there in black and white, so we do that for you. So this study was published in JAMA Open Network in November the 25th, 2024, and the study found that discontinuing nursing home residents' blood pressure medication or reducing their dosage by 30% did not lead to hospitalization for heart attack or stroke. And they followed them for 2 years, and they compared their findings with people who continually took their blood pressure medications. The researchers analyzed the electronic health record data from long-term residents aged 65 and older who were admitted to the U.S. Department of Veterans Affairs Community Living Centers. These residents were taking at least one blood pressure medication. Nearly 18% of the roughly 13,000 residents had their blood pressure medications reduced in dosage and or frequency for at least 2 weeks. The researchers monitored them for over 2 years, and they found no significant difference with risk of hospitalization or heart attack or stroke between those who discontinued or reduced their blood pressure medication and those whose prescriptions remained unchanged. So this outcome may be attributed to the side effects of the medications potentially outweighing the benefits of those tightly controlled blood pressure. This is according to Michelle Auden, who is an associate professor of epidemiology in the Department of Epidemiology and Population Health at Stanford University School of Medicine. Quote, the other possibility is that high blood pressure may not be as risky in older people with a lot of health conditions or other conditions such as frailty that require them to live in a nursing home. Also, the residents who reduced or discontinued their blood pressure medication tended to have slightly lower systolic, which is your top number, and systolic bottom number blood pressure levels before going off the medication. This group was also on more antihypertensive drugs and had a history of conditions such as diabetes, kidney failure, and acute kidney injury. So these are people that have a lot of things going on with them. Some people, their blood pressure just runs high. Don't know why that is. Could be diet, could be genetics, just a lot of things. So again, it's not one size fits all. Now, do I want you to have high blood pressure? No, I don't want you to have high blood pressure. And we do recommend for those people who have really high blood pressure that they might want to do a little bit of medication because we don't want them stroking out and that kind of thing. So high blood pressure is a significant risk factor for cardiac disease. Blood pressure medications need to be taken for life if you start them, especially if lifestyle changes fail to yield results. Now, I have never seen anyone who lost weight and changed their diet need to be still on blood pressure medication. I'm just saying, I've never seen that. Most people do not want to make the lifestyle changes necessary in order to regain their health. I have a friend who is constantly walking around in pain and inflammation, and I explained to her that if she would, change her diet, that she could probably get a lot of relief. And she looked at the list. I gave her an anti-inflammatory diet list, which is you don't eat this, this, and this. And I said, if you'll quit eating this, you might find that you are a little bit more comfortable. And she said, I'm not going to do that. She said, I'm not going to give up the foods that I love. And it's like, okay, well, that's your choice. You can choose to change your diet, change your lifestyle, or choose to take medication. It's just always your choice. Not controlling hypertension can lead to serious complications. For example, a 20-point increase in systolic blood pressure and a 10-point increase in systolic blood pressure can double the risk of ischemic heart disease, heart attack, and stroke. So we want everybody's blood pressure to be around 180, 120 over 80, all right? Most people are not there, okay? Mine is actually lower than that. Mine's probably around 115, 117 over about 70, okay, which is well within range. If you get to 140 over 85, that's pre-hypertension, right? And then if you go to 150, 160, 170, we don't want that because we don't want you stroking out. So we want you to be below 140 over 85. Optimum is 120 over 80. So that's the optimum. Those are the last statistics that I have seen. So we want you to be able to manage your blood pressure within those situations. Now, I will just tell you, my husband, when I married him, he was on 2 medications. He was on cholesterol medication and he was on blood pressure medication. Now, we did away totally with the cholesterol medication and his cholesterol is fine. He still is on a slight amount of blood pressure medication just because we don't want him stroking out. But the main thing is, when this man works, when he goes out and does a whole lot of physical activity, his blood pressure just goes way down. It's 120, 115, something like that. I mean, his blood pressure comes right into normal range when he has a lot of physical activity. He just runs hot. That's just the way his body works, and that's why a one-size-fits-all just doesn't work for him. And a 2015 investigation found that people with particularly low blood pressure and those taking multiple blood pressure medication faced more than double the risk of death compared with others who had high blood pressure, highlighting the dangers of over-treatment in failed populations. The new study reported that these findings contrast with earlier Cochrane review. Now, the Cochrane review was done in England, and they said that this particular test was very poorly designed, did not follow people for a long period of time, but a lot of doctors still look at this report and they make their recommendations off of this report. And so, they have found in this new information that this particular study was not good. They didn't follow up on the people. They didn't do all the things they were supposed to do. So apart from preventing cardiovascular disease, blood pressure medications are also prescribed to avoid kidney damage. However, research has suggested that going on blood pressure medication long term may do the reverse and damage your kidney. So it would cause kidney damage. Now, a study published in Circulation Research in October of last year gave a potential reason why long-term use of renin-angiotensin system, RAS, inhibitors are commonly prescribed blood pressure medication, which can lead to kidney damage. So renin is a protein that increases your blood pressure. Cells in the kidneys release renin when your blood pressure is low, and they stop releasing it when the blood pressure needs to be lowered. Renin also activates angiotensin, which constricts your blood vessels, leading to an increase in blood pressure. So RAS inhibitors reduce blood pressure by blocking these various biochemical processes. Now, research was conducted in mice, and three-dimensional imaging was used to detect the damage and changes in the animal's kidneys. Researchers found that suppressing renin and angiotensin with antihypertensive causes the blood vessels in the kidneys to balloon, causing kidney damage. So there are a lot of reasons why I don't like drugs, right? If you're having a heart attack, if you've had a car accident, then you need to go and the doctor, and you need to have medication. I'm all for that, but I'm not really for medications as a lifestyle. She goes on to say, we found these RAS inhibition drugs cause widespread vascular disease, impacting all the areoles, which are tiny blood vessels, and their associated glomeruli, which is the kidney filtering units. This is according to Dr. Maria Sequeira Lopez, and she's a professor at the University of Virginia School of Medicine, and she was a co-author of the study. She says that RAS inhibition was also linked to increased scarring and inflammation and disorganized nerves in diseased blood vessels. Now, none of that is good news. None of that is good news. And so if you're taking notes, if you're taking blood pressure medication, you might want to talk to your doctor, because you don't want to be having something that's going to hurt the blood vessels in your kidneys. Your kidneys are kind of important. Your heart is important, so we need to make sure everything is taken care of. So the decision to stop taking blood pressure medication is complex and must be discussed with your doctor. Now, when people come in to see me, and I'm sorry, I've got a scratchy throat today. I'm sorry. When people come in to see me and they want to get off their blood pressure medication, I tell them, I cannot get you off your blood pressure medication. That is something that your medical doctor needs to do. But what I want you to do, because we're going to be working on the body, we're going to be bringing health and restoration to the body, I want you to keep a journal every day. My high blood pressure people do a blood pressure journal. My high blood sugar people do a blood sugar journal. Why is that? Because as we bring health and restoration to the body, those numbers are going to come down. The high blood pressure numbers are just naturally going to come down. If you get on an anti-inflammation diet, then you're going to lose weight. You just are going to. And if you're not as heavy as you were before, then you're not going to need as much medication as you needed before. I can't tell you that because I'm not qualified to do that. But if you have a journal and you can tell your doctor, I've lost 20 pounds, I've lost 40 pounds, whatever it is, my blood pressure was XYZ and now it's much lower, I need you to adjust my medication, then your doctor will do that because you've got the evidence in your journal of what you're dealing with day to day. The same with blood sugar. If you're on insulin or you're on whatever medication you're on for blood sugar, and you change your diet, you limit your carbs, you do all the things that you're supposed to do, then your need for the medication is going to be reduced. And so if you don't have that journal so that you can talk to your doctor, then your doctor is not going to have any kind of firm evidence that he needs to adjust your medication. Now understand that medical doctors never see people get better. They just don't. The medication manages the symptoms. It doesn't heal you. Natural foods heal you, okay? Your own body heals you. So the way Western medicine works and the way we here in the United States work, we're lazy. We eat all the fast food, we eat all the packaged food, we do all the things that we're not supposed to do. And so the medical system really rarely sees anybody get healthy. And when they do, it's kind of like a miracle and nobody really expects it. So if you don't have those journals, you're not going to have the evidence that you don't need as much medication, and that's really, really important. So key factors in determining whether to reduce or stop medication include your life expectancy, how many medications you're taking, and whether you have any pre-existing health conditions such as dementia or physical disabilities. According to Sequeira Lopez, some evidence in the mice indicate persistent damage even after prolonged medication is discontinued, although the kidneys have considerable reserve function. She says, and this is a quote, discontinuation of short-term treatment in mice can reverse the pathology, but in humans, we don't yet know at what point it may become irreversible. So these are some things that we need more research on. And these are some things that you need to keep in mind when you're wanting to get off medicine. Almost everybody who comes and sees me, that's one of their goals, is to get off medication. And I applaud that. I'm on no medication. I don't want to do medication. I do all the healthy stuff, the herbs, supplements, and all that kind of stuff. And I'm thankful that I don't have to do any kind of medication at the moment. Hopefully, I can keep it that way. Identifying the cause of hypertension in each case and the development of personalized precision medicine approaches for the treatment of hypertension would be a future goal to avoid potential unwanted side effects. Now, this is important because remember I said it is standard of care. We don't want to do standard of care. Now, if you want to do holistic, if you want to manage your blood pressure in a different way, then you can change your lifestyle. You can change your food. You can change your stress. You can do a lot of things to help you get where you need to be. So many people believe that high blood pressure is a lifestyle, lifetime condition, but you can change the way your body works. And we have all kinds of evidence here in the clinic. Traditional Chinese medicine says that blood pressure is not considered an illness in itself, but it is rather a warning sign from the body. Factors commonly believed to contribute to elevated blood pressure are excessively cold weather. Now, we can't claim that here in South Texas, okay? Stiffness in the shoulders and the neck, extreme emotional fluctuations, and then high blood viscosity. Thick blood are the underlying conditions, and you may even have a heart situation that needs to be looked at. So in cold weather, the sympathetic nervous system becomes overactive, leading to an increase in adrenaline and the constriction of peripheral blood vessels. So when that happens, the blood has to push harder, the heart has to push harder to get the blood to go through those constricted vessels, which in turn raises your blood pressure. So getting warm, wearing more clothes, and drinking hot beverages can reverse that if that is the reason that your blood pressure is high. In a cold environment, people may experience stiffness or pain in their neck or shoulders, contributed by elevated blood pressure. Spending long hours every day staring at your computer and smartphones also leads to shoulder and neck stiffness, which restricts the blood flow to your head. And this restricted blood flow can cause symptoms of dizziness, high blood pressure, and insufficient oxygen to the brain. And no one needs that, right? We all need sufficient oxygen to the brain. So one thing that you can do holistically, there are a couple of things that you can do. So here is the crick in my elbow, right? The inside of my elbow. You can take your finger and just start running circles in that crease, okay, in the crease of your elbow. You can just take your finger and rub circles in that crease. And what that does is it activates that meridian that is there, and it will open up your blood vessels, and it will cause your blood vessels to open up and your blood pressure to be lowered, okay, to be relaxed. This promotes smooth blood flow to the neck, and it ensures adequate blood flow to the brain. There's an increasing number of studies that suggest that acupuncture can lower blood pressure in patients who have hypertension. According to traditional Chinese medicine, the meridians are the channels through which the energy flows in the human body. They are responsible for transporting the qi and the blood. Now, I know I have a lot of people who listen to me and watch me, and they're Christians. And as soon as I start talking about qi and traditional Chinese medicine, they cut me off because they think I'm into some kind of new age issue. No, not in new age, okay? They have these high-powered microscopes. Can't remember exactly what they're called. But used to, they could only see, you can see your blood veins here, right? That used to be the only circulation system that they could see. As they got more sophisticated equipment, they can see now that on top of your blood vessels, you've got another layer of vessels, which is where your lymphatic fluid flows. So if you don't know what your lymphatic fluid is, if you've ever had a blister and you've got that that clear liquid in the blister, that is your lymphatic fluid. Your lymphatic fluid is the vacuum cleaner of your body. So we've got our blood vessels that we can see, but we also have tinier vessels on top of that we cannot see with the naked eye, that channels our lymphatic fluid and helps get our cells what they need to be doing. On top of that, we also have the acupuncture vessels that carry the qi. That's what the traditional Chinese call it, or we just would call it the breath of God, the life force, okay? On these high-powered digital microscopes, they can see those channels. So it's not new age, it's not hocus pocus, it's not anything like that. This is something that is absolutely scientific, that the people that have the money to have those high-dollar microscopes, they can see all that. So you want to make sure that you are looking at all the different opportunities that you have to get healthy. And one of the things is acupressure or acupuncture. And I will just tell you, acupuncture looks really scary because you're sticking all these needles in you. But I have done it, and guess what? No problem. Doesn't hurt. It only hurts if they stick you in a hair follicle, and then you're going to feel some burning. But when you tell them, I'm a little hot there, they'll take it and they'll move it, and you'll be just fine. So the traditional Chinese believe that there are 12 major meridians, each corresponding with a specific organ. And along the meridians are specific points known as acupoints, which possess unique function. Now, there's another place, just like in the crick of your elbow right here, you can do little circles. You can also, on your hand, take the thumb of your other hand and just do little circles right in the middle of your palm. And that also will relax your body, and it will cause your blood pressure. If you have high blood pressure, it will cause your blood pressure to lower in a natural way. And that's what we want to do. That is exactly what we want to do. Now, here in the clinic, we've got a little bit more sophisticated than just, doing little circles in your palm. Not that I'm opposed to that. I'm not opposed to that at all. Like I say, I've done acupuncture, I've done acupressure. In my clinic, I have a tool that works on your meridian points to see what's going on in the body. So this is something I absolutely believe in. If you want to take a supplement or some kind of bioidentical, then we've got a couple of options. We've got more than this in the clinic, but this is something that works, I would say 100% of the time. This is called Biocardiazine Forte, and it is a vitamin that also has a lot of herbs for your heart. And so we've had people that have hypertension, do not want to take medication, and so they come in and they do these heart vitamins, and guess what? Their blood pressure stays normal, and so that's an option that you can do. And remember, I am not a medical doctor, so don't take my advice for getting off your medication, because I cannot advise you on that. But what I can say is we've got some alternatives for you to try in conjunction with what you're doing. Keep your journal, and as the holistic starts to work on your body, then your need for the medication is going to come down, but you're going to have that evidence in your journal that you can take to your doctor so that your doctor could say, oh, okay, you're doing something different. You don't need so much medication. Okay, great. We've got another formula that I have had for, forever, okay, 20 years probably. This little medication actually can rebuild your heart. So if you've got congestive heart failure, if you've got some problems with your heart, this is just amazing. I had a lady who called me probably about 20 years ago, and she said, Dr. Polly, do you carry Pure Herbs HT Combo? And I said, I absolutely do. She said, let me tell you about this. And so she's telling me her story, and it was an elderly relative. I can't remember if it was her husband, her father, her grandfather. I can't remember. It's been too long. But it was an elderly male relative that went down to the medical center and had heart grafts. Don't know exactly what the official thing was, but heart grafts. At the same time, she put him on this herbal formula. A year later, they went back to the medical center here in Houston, and they, did the checkup of the heart, and they came out and they said, we don't know what to tell you. And, the family is like, oh my God, the news is not going to be good, whatever. And the doctor said, the heart grafts that we put in last year have failed, but the patient regrew his own parts. So it's like he has a brand new heart. And so that's what we read in the literature that happens, but this is a human being that called me and told me that this is in fact what happened to her elderly relative. And so I feel really, really comfortable. You guys know that we do iridology. You can see the iris pictures in the back. You've got reflex places in your eye that show your heart. This girl right here has a marker in my eye that says I have a real problem with my heart. Now, do I have a problem with my heart? No. Does anybody in my family have a problem with their heart? Well, at the time that I learned about this marking, no. But my mother has just recently been diagnosed with congestive heart failure. Now, she is elderly. She is in a assisted living place now. And what's funny is she's never had blood pressure issues before, but she is on medication for blood pressure now. I wanted to put her on a mushroom formula that is for cognitive decline, and they won't put her on that because it lowers her blood pressure, and she's on blood pressure medication. This girl says, get her off the blood pressure medication and just let's work on her. Their perspective is standard of care. So this is why we always give you the information so that you can make the best choices for you, and you can do what you need to do in order to maintain or regain your own health. Remember, we are our own best advocates. Nobody else is looking out for us. Our medical doctors love them, but they're doing standard of care. What are your symptoms? What do we call it? What drug do we give you to manage the symptoms? We look at what is it? What's causing it? Let's take care of the cause, and then the body heals itself. That's the main difference between allopathic medicine, which is what you're going to get at the hospital, and holistic medicine, which is what you're going to get with me. That was a lot of information on the first Friday of 2025. So if you have any questions, let me know. Thank you for commenting. Thank you for liking. Thank you for sharing. Thank you for all the things. And thank you so much for just honoring me with your time, because it's really, really important. And I know you could be doing a bazillion other things on this first Friday of 2025. I will see you next week. Have a great weekend. Relax, rejuvenate, refresh, and I'll see you next week.